Ladies and gentlemen, we are happy to to have you around for this webinar this evening, which is a repeat of the unsuccessful webinar that we had last time. As it is now, we are grateful that we will be able to actually have dietitian Deborah Ododo present to us. The presentation has been recorded, but before we start playing it, she's also on here attending physically to take our questions. May I ask Mrs. Grace Akikule to read the citation, and then she will also coordinate the question and answer session. Thank you. Mrs. Akikule.
Thank you, sir. The President. Good evening, all. Once again, I want to welcome us to the webinar September section. We have in the house a seasoned lecturer who has really dealt with the topic in person of dietitian Deborah Ododo. She is a clinical dietitian, a public health nutritionist from the Department of Nutrition and Dietetics, Ahmadu Bello University Teaching Hospital, Zaria. She is here with us to enlighten us, and I believe that we are going to gain much from her this evening. So once again, I welcome you all. The topic for tonight is role of nutrition in pain management, African pain camp experience. I wish us well and good listening. Thank you so much. I finished. President. Prof. Professor Oyel.
Recording it.
The International Association of IAS organized the last African webinar.
Is it my network? We can't hear her.
I know you, sir.
So why? Um, Speaking. So why can't we hear her? Please, can you hear her now?
No, sir.
No, sir.
I guess it's network issue.
I think it should work now. So we can pause and stop share. We can share. Um,
Hello, everyone.
Can we hear her now?
Today, I'll be talking about the role of nutrition in pain management,
You can hear you.
and I'll also be sharing about my experience at the first African Pain Camp meeting. The outline for this presentation is as follows. Objective of the presentation, African Pain Camp experience. Largely, we'll be discussing the role of nutrition in pain management. We'll look at the causes of pain. We'll also talk about anti-inflammatory diets. And then we'll take a look at multidisciplinary team role as it relates to pain management. Two major objectives for this presentation. One is African Pain Camp experience sharing. Secondly, is to understand the role of diets in pain management. The International Association for the Study of Pain, IASP, organized the first African Pain Camp in Nairobi in February 2025, and I was opportune to be one of the participants. I want to say a very big thank you to IASP for giving me the opportunity to be part of this pain camp meeting. I will be sharing my experience from a dietitian's perspective. The first African Pain Camp took place in Nairobi, Kenya, in February 2025. The camp was an intensive 4-day residential event that brought together healthcare professionals dedicated to advancing pain management across the continent of Africa. The primary purpose of the camp was to advance a multidisciplinary approach to pain management by improving the knowledge and skills of healthcare professionals. However, I noticed a major multidisciplinary team gap, and despite a diverse attendance from various African countries and a wide representation by healthcare professionals, I was the only dietitian among several healthcare providers. And initially, in the first 2 days of the camp, literally nothing was said about nutrition in pain management. And so I raised my observations, and my concerns about this omission were met with overwhelming support. The buy-in for integrating nutrition was immediate and widespread, leading to its inclusion in every subsequent presentation and patient case formulation throughout the remaining 2 days of the camp. And so for the last 2 days of the camp, nutrition became the cornerstone of discussion, fostering a collective realization among healthcare professionals about the indispensable link between diet and pain management. I want to say a very big thank you to Dr. Rice, the current IASP president, and to all the amazing faculty and participants. Thank you for your massive support. With your support, we are championing the cause for nutrition in pain management to the ends of the world. So I want to say a very big thank you to the participants and the faculty staff. And so in the next few minutes, we'll be looking at the critical role of nutrition in pain management. Nutrition plays an important role in pain management, and healthy eating patterns are associated with prevention, reduced systemic inflammation, lower risk of chronic conditions, and associated comorbidities. Nutrition basically is all about what we eat, how our body metabolizes or uses what is being eaten. So an individual's eating pattern over time is a major determinant of the well-being of that individual, as it determines the nutritional status of the individual, and that invariably determines the health status of individuals. And so the role of nutrition in pain management is an emerging field, and this is very evidenced by my recent experience at the first African Pain Camp meeting. However, evidence from few studies available has shown that optimizing diet quality and incorporating foods containing anti-inflammatory nutrients and certain antioxidants can actually lead to reduction in pain severity. So what then are the causes of pain? Now, during the camp meeting, we were made to understand that pain itself, it's a disease condition and it should be managed as such. However, we also know that patients who experience pain actually also have an underlying medical condition. So pain can be caused as a result of the disease condition itself. It can be as a result of complications of diseases. For example, a diabetic patient who is already experiencing complications of diabetics like neuropathy, or probably has lost a limb, can be a major, this complication can actually be a major cause of pain for such patients. And then thirdly, you have therapy administered. For example, chemotherapy, radiotherapy. This is very true for cancer patients. We know that this therapy actually have negative and painful side effects on such patients, which is also a major cause of pain in such patients. And then fourthly, you have medication side effects. There are medications that actually cause painful or negative side effects to patients. Fifthly, you have unhealthy diets, and this is very true for individuals who take a lot of saturated fats or refined foods. This can affect their nutritional status and can bring about complications or negative or painful complications, which can also be a major cause of pain for such individuals. Nutrition challenge for pain. Pain can affect what one chooses to eat or drink. This is very true for patients who have challenges, who have dental challenges. Chewing becomes a challenge, and that invariably impairs their nutrient requirements or affects their nutrient intake. Another nutrition challenge is that what you eat influences risk of chronic conditions. We already said that patients who take a lot of saturated foods or refined foods actually experience or have negative impact on their nutritional status, and this can be a challenge, a major challenge for pain, a major nutrition challenge for pain. And then pain reduces ability to plan ahead. Most individuals who experience pain are actually not in the right frame of mind to think or plan or shop for food. And so they tend to make do with whatever food that is readily available, either healthy or not. So these are some of the nutrition challenge as it relates to pain. What then is the interaction between pain and nutrition? One, we said too many side effects from medications for food to be enjoyable. This is also very true for cancer patients. These patients actually experience negative side effects as a result of their therapy. Negative effects like dry mouth, their taste buds are altered. So food is not something they look forward to. And then secondly, pain can be a higher priority than, dealing with pain can be a higher priority than eating. So patient is in so much pain and eating is not a priority. In some occasions, pain actually overrides the hunger signals. And then for some patients, they are too lonely and they're in so much pain to eat. And that is very true for senior citizens, that's the elderly. Pain can also keep patients awake. Some patients are too painful to sleep, and for some, keeping awake means nibbling all through the night, and that can also have a negative effect on their nutritional status. While pain keeps certain patients from eating, for some patients, food is actually the only enjoyable thing. They use food to distract their mind of their pain. So for some who experience pain, all they do is eat and eat and eat anything that is readily available, either healthy or not. As long as it distracts their mind from the pain, they tend to overindulge in food, and that can also affect their nutritional status and well-being. Medications side effect is also another challenge that patients experience. Medications and certain therapy can have side effects and a negative impact on nutritional status. Some of these negative effects include constipation, diarrhea, nausea, appetite changes, dry mouth, and so many other negative side effects. It's important we note that these painful side effects can actually be managed by appropriate dietary intake. So diet and nutrition actually play a critical role in the management of patients. Pain, sleep, and malnutrition. Pain that keeps people awake, impairs sleep quality, and also affects the appetite hormone. Patients with pain might eat less or more unhealthy diets during acute pain episodes, and this can increase their risk of malnutrition, either overnutrition or undernutrition. Pain can also decrease the physical activity of patients, and this can lead to increased body mass. And if obesity and inflammation coexist, then there's additional, the patient tends to experience pain as a result of both obesity and its complication and inflammation at the same time. And the role of diet in pain management. Number one, we already said that diet plays important role when it comes to pain management. So the role of diet in pain management is number one, to manage and treat the medical condition itself. Now, most times when patients are in pain, the immediate line of action is actually to relieve the pain of the patient. However, when it comes to diet therapy is an holistic approach. So beyond managing the pain of the patient, what diet does is to manage the medical condition of the patient itself. For example, a diabetic patient who already has complications of diabetes and is in pain, beyond relieving the pain of the patient, diets can be used to manage the diabetic condition itself. So diet therapy is a holistic approach. It manages the pain of the patient, and then it also manages or handles the underlying medical condition of the patient. Secondly, the role of diet therapy in pain management is to ensure good nutritional status, to ensure that the patient is in good nutritional status and is better able to withstand other treatments. Now, there are certain surgeries or certain therapies that will not be administered if the patient is in poor nutritional status. So diet ensures that the patient is in good nutritional status and then is able to undergo other therapies or other medications that as it pertains to his disease condition. Another role of diet in pain management is a major role, and that is diets can be used to minimize or treat the inflammation of that is the cause of the pain. So diet therapy or diet treats the medical condition of the patient. It ensures the patient is in good nutritional status, and then it minimizes infection. And when all that happens, it hastens the recovery, the healing process and the recovery of the patient, and then at the same time, it shortens the length of hospital stay. So these are the roles of diet in pain management. Anti-inflammatory diets. A diet made from foods with anti-inflammatory properties helps to reduce inflammation and pain, and this has been confirmed by few available researches. So omega-3 fat increases the synthesis of anti-inflammatory cytokines. As such, in addition to a patient eating an adequate diet that is appropriate for its medical condition, an increase in the intake of foods high in omega-3 fatty acid is important in the management of pain. So we already said that diet therapy is a holistic approach. It goes beyond managing the pain of the patient, but it also treats the underlying medical condition of the patient. And omega-3 fatty acid is very instrumental in the management of patients who experience pain. So these are some of the foods that are rich in omega-3 fatty acids. You have your flaxseed, your navy beans, walnuts, leafy green vegetables, squash, kidney beans, olive oil, salmon, fish, etc. Aside foods that are rich in omega-3 fatty acids, you also have other categories of food that actually have anti-inflammatory properties. You have vegetables like leafy green vegetables, broccoli, bell peppers. Then you have the whole grains and the legumes where you have the brown rice, the whole wheat, the beans. And we also have categories of fruits that also actually have the same effects, like the apples, the grapes, the berries, the oranges. It is important that depending on your locality or region, it's important you find out what are the foods that are locally available within your reach that actually have these anti-inflammatory effects or properties that can be used in the management of patients with pain. Multidisciplinary team role. Pain management in different disease conditions require a multidisciplinary team approach. However, nutrition is at the intersection of all medications, therapy, or regimen. Hence, nutrition is key in the management and prevention of pain. Now, we know that every member of the team is important. Every member of the team has vital roles to play. However, we realize that nutritional care or nutrition is at the intersection of every other medication or services that is being provided by healthcare providers. the pharmacist will always insist that this patient eats before medication. The nurse will not carry out certain or nursing procedure until the patient has eaten, and it's the same for other healthcare providers. However, the only challenge is that we're not really paying attention to what the patient is eating, and that is why the dietitian being a part of the team in pain management is very vital. So nutrition is at the intersection of all medications and therapy, and it's important that every member of the team should be fully represented in the management of pain. Okay, this is the traditional multimodal management of pain, and I want to say appreciate Dr. Mary Cardosa, the incoming IASP president. I want to say thank you for giving me the permission to use this image. So in the interdisciplinary, in the traditional multimodal management of pain, you find out that in most of our facility, this is what is obtainable. Not every member of the team is fully involved in pain management, and most times the patient, it's not even carried along in his own pain management. So everybody just do their bits, the patient gets some relief, and then he returns back to his normal function. However, if you look at the interdisciplinary multimodal management of pain, it's more comprehensive. You have a larger representation by various healthcare providers. The patient is involved in his own pain management. And then at the end of the day, you find out that the functionality of the patient is optimized, and then the quality of life of the patient is also improved. So this actually should be the ideal when we talk about interdisciplinary multimodal management of pain. And I want to say a very big thank you once again to Mary Cardosa. Initially, when she projected this image, diet and nutrition was actually not part of it. However, when I raised my observation, she graciously included diet and nutrition. So I want to say a very big thank you to Dr. Mary Cardosa for the permission to use the image, and also for championing the cause of nutrition in pain management. I also want to say a very big thank you to Professor Nwaso. Professor Nwaso was actually the one who gave me the first opportunity to be part of pain management or pain team in 2017, and see how far we have come. Thank you very much, Ma. So my participation at the First African Pain Camp was like a springboard, and so the mission continues, and that is largely to expand the reach and impact of nutrition in pain management worldwide. I want to say thank you to Romy, who kept giving me the push and linked me up with my Nigerian team members. So I say a very big thank you to the Nigerian team. Thank you for your massive support. Thank you you guys are the best. And so I invite everyone listening to this webinar to join us in championing nutrition as a cornerstone of pain management. Together, we can create a healthier, more comfortable future for individuals living with chronic pain across the globe. So our three major key messages, take-home messages. Number 1, adequate nutrient intake and healthy eating patterns are associated with reduced systemic inflammation, as well as lower risk of pain, chronic conditions, and associated comorbidities. Foods high in omega-3 fatty acid specifically reduce inflammation and pain. Appropriate dietary or nutritional intervention is one of the most useful tools in improving overall health outcomes in patients. So, nutrition plays an important role in health, and integrating a dietitian in pain management team to provide evidence-based nutritional care that improves quality of life ultimately aligns and supports comprehensive treatment plans. So, in the voices of the Kenyan people, I want to say a very big thank you to everyone who has taken out time to listen to this webinar. Asante sana.
Thank you so much, Dietitian Deborah Ododo. We appreciate you for the thought-provoking and educative presentation. I want to say now that it's time for contribution, question, answers. If you have any question, you can drop it in the chat box. Thank you.
The moderator, ma,
Yes, sir.
we have an important personality in the house, and
All right.
I know she will have something to say about the presentation of today. That the mother of SSPN Nigeria, in person
Oh,
of
okay.
Professor Shoyanwu.
Wow. Oh, I want to welcome you, ma. You are welcome into this webinar, the September section. You are powerfully welcome, ma. You are recognized.
Blood cancer, statements about blood cancer on it.
Oh, thank you very much. In fact, I was just about to send a message and apologize and leave, that I have to leave. I'd like to say hello to everybody and congratulate the presenter. I was also very interested when I saw that a nutritionist has become a very active member of the Society for the Study of Pain. And you can see how wonderfully she has presented to us and given us the facts about how important nutrition is in pain management, because if the immunity of the patient is on the low side, of course, pain will be more, and also treatment will be more difficult. Thank you very much. And the more we are, as she said, multidisciplinary, interdisciplinary, is very important for effective pain management. And thank you for being part of our dynamic team in Nigeria. Congratulations.
Thank you, ma, for finding time to attend, ma. I know that you will soon be leaving for another meeting, but we appreciate your coming, ma.
Thank you. Thank you.
Thank you, ma.
Thank you very much.
Yes, ma.
Thank you.
Thank you, ma.
Dr. Akinwale has his hand up. Dr.
Yes.
Akinwale, you have background noise, please. Can you just let that background noise be reduced and then speak up now?
Okay, good evening. Actually, I'm in a quiet room. Maybe it's not from me. Good evening. Can you hear me, sir? Yeah, good evening, everyone.
Yes, we can.
I thank Mr. Dodo for the presentation. Yeah, she mentioned some foods that have a pain relieving properties. But what I want to know, what are because we have some local foods, which the one you mentioned, and also not a lot of people in locality have access to look at those foods. But in our environments, maybe Hausa foods, local food, Yoruba local foods, or Igbo local food that have these three factors you mentioned. Then second, you know that here in Nigeria, or maybe in Africa, we tend to overcook our food because cooking suppress or kill the pain properties in those local foods. Thank you, ma'am.
Thank you, sir. Dietitian Deborah Ododo.
Yes, ma. Good evening, everyone. I want to start by saying a very big thank you to SSPN. Thank you for giving me the opportunity to make this presentation. So I really appreciate. Thank you, Mr. President, and the entire SSPN team. Thank you very much, sir, for your question. During the presentation, actually, I mentioned that there's actually need, depending on your locality or where you're based, to actually collaborate with your dietitian in your region to find out what actually are the locally available foods that actually have these anti-inflammatory properties. We have a lot of locally available foods within our reach, and a lot of them also have anti-inflammatory properties. For example, like I said in the slide, the omega-3 rich foods, where you have your fish, your walnuts, where we actually have native walnuts in Nigeria. And it's, I think, popular even in the western parts of the country.
Hello, can we hear? Can we hear? Hello?
I think it was breaking. I didn't hear very well. It was breaking.
Yes. We can no longer hear.
See, I think it's network issue. She's not even again on the platform again. So she's
My
having
president, sir.
yes.
Hello, sir.
Yes, Dr. Lateji.
So while we are waiting for Dr. Akewale to return to the platform
No, I can while leave.
after a
Dietitian
good
Ododo.
network. Oh, is it okay, Dr. Dudu? I will
I'm
not, I can still remember some years ago in Lagos.
Okay, she's back.
Uh,
She's
okay,
back.
she's back. Okay.
Can you continue, Dr. Dietitian Ododo?
okay. I'm so sorry. My network has been very. So I was just saying that we have a lot of these locally available foods within our reach, within our means. So it's important that we look inward and find out what are exactly are these locally available foods that we have within our reach. Like I said, we have the native walnuts, which is very popular in the western parts, and we have several species of vegetables. So what is important in your food or in your meal is actually to include a lot of varieties. Don't just stick to one particular type of food. Varieties of vegetables, varieties of fruits, varieties of nuts should form a major component or a major part of one's meals. Secondly, sir, you talked about cooking that actually reduces the nutrient content of food. Very true. No matter what you do, nutrient content or nutrients will actually be lost. But it's just to find out the appropriate way to cook each particular food such that the loss of nutrients will be fully minimized. Definitely, food has to be cooked. We can't, it's not every food that can be eaten raw. So, but it's just to find out the appropriate method of preparation that will minimize the loss of nutrients. I don't know if I've actually answered your question properly. Thank you, sir.
Yeah, thank you very much, ma'am. Thank you.
Thank you,
I
sir.
have a contribution, sir.
Go ahead, please.
Hello, sir.
Go ahead, Dr. Lateju,
Okay, okay, thank
please.
you. So, in addition to what that teacher Ododo said, some years ago, we had a conference, SSPN conference in Lagos, and the speaker in that conference laid emphasis on pineapple. She told us that pineapple contains bromelain, which triggers our body ability to fight pain and reduce swelling. So I will never forget that experience. So pineapple is another fruit that contains agent that can reduce pain or fight pain. Thank you. That's just my contribution.
Thank you, sir.
Okay, let me respond to Dr. Lateju. Actually,
Thank
that's a main research area for me. We have what is called bromelain, and we had done a lot of extensive work on the therapeutic effect of bromelain, which is actually derivable from pineapples. And so instead of using pineapples, we actually got the active ingredient from it. And bromelain is actually sold in the market. You can order it from outside Nigeria, and it's packaged from Amazon and what have you. And to treat other things apart from even neuropathic pain, especially osteoarthritis and other stuff. So just to add some words to what Dr. Olateju did, I had a student on it who did a PhD. The student is on that particular bromelain, and we had like four publications, one in Nature public, one in scientific report, and he is currently in the US. So we've done quite a lot of work on the therapeutic effect of bromelain that is derived from pineapples. Over to you, Mrs. Akinkule.
Thank you, sir. I have question too, sir. I
Yeah,
just
ma'am.
want to clarify how far is it true about some food ingredients such as garlic, ginger, and clove? In how far are they? Is it true that they are good and active ingredients in reduction of pain? Over to our presenters. Presenter ma. Dietitian Deborah
Hey,
Odudu.
hey. Uh, I don't think she's here again. Yes, it's not Hagen.
Hello, hello, sir.
I think there are
Hello.
Okay, you are welcome back.
Hello?
Yeah.
Yes.
Yeah, Doctor.
Actually, there are a lot of active ingredients in garlic, sulfur compounds like allicin, which is actually a very active ingredient. And usually for people who suffer from arthritis or gout, it gives a lot of relief. So you're very correct, ma. There are a lot of active ingredients in garlic, ginger, and even onions. But it's just important that sometimes when you make emphasis on these active ingredients, people tend to overindulge or abuse it, and then it begins to also have a certain negative side effects when it's overused or abused, especially for patients who have ulcer and all that. So it's important that moderation should actually be the watchword to everything that we do. Thank you, ma.
Thank you, ma. Then there's another question in the chat box, ma, from
Okay.
one of the participants. He says, which specific Nigerian food items are rich in omega-3 fatty acid?
Okay. Omega-3 fatty acid largely is found in fish. However, even the walnut I talked about, like I said, there's a walnut that is actually particular to the West. Even those of us in the North here, they bring it from the West for us. And then we also have flaxseed in the North here that is also rich in omega-3 fatty acid. Even avocado pear has some level of omega-3 fatty acid. But the richest source of omega-3 fatty acid is actually our fish. So these are just some of the Nigerian foods that are rich in omega-3 fatty acids.
Thank you, ma.
Yes, ma'am.
I want to ask if there's any other question, contribution, or clarification.
Yes, ma.
Hello.
Hello, ma. My hand is up.
Oh,
My
okay.
hand is up, ma.
All right, Dr. Akinwale.
Yeah. Yeah.
Over to
Sorry.
you.
My question is to Professor Oyele, the president. Yeah. You talk about the bromelain that is found in the pineapples. So I want to know what efforts has been made locally to be produced instead of being importing it from from other countries, which would be more expensive. Have they made any efforts so that we can have it locally produced? Thank you, man.
Okay. I, I think one of the most popular story about my work was during the COVID era when we actually postulated that bromelain is so good that it helped to regulate the immune system. And actually, we have got publication from Australia and the US to say that it does not even allow the COVID virus to bind to the angiotensin receptor. I hope I'm right, and the receptor in the lungs and in the body. And then we postulated that if you take your pineapples, it's going to be very good in giving you immunity against COVID-19. And it was all over the whole Nigeria. We got AIT, everybody coming to interview us. And our assumption and whatever we have done was correlated by other people outside Nigeria. So we did say pineapple because we know bromelain is very expensive. So if you tell people just go and eat your pineapples and then get well, so you are going to have a good supply of nutrients in addition to the active ingredient that is actually needed. And we got a report from, sorry, we got report from some other people that says that they were down and when they ate, one person actually on Twitter, which is now X, actually said that that was the only thing he was able to eat during the time that he was infected with the virus, and he did survive. So I've got people even contacting me. So why I'm saying this is that I do not know. We didn't make any effort. We actually reached the Ministry of Health during that period in Kwara State, but nothing came out of it. And it's just a simple thing. You could just make it into something like a fruit juice and then give to people who have this ailment. The procedure is that it work on cytokines, and then we'll be able to reduce in addition, reduce the cytokine storm phase of the COVID-19 infection. I'm afraid we did try to reach out, but nothing has come out of it. So we have to then start to tell people that, look, it's already being produced. People are already using it. So get to Amazon, get to pharmaceutical industries, and you can probably get it. But no attempt to try to produce it here.
Well, thank you, sir.
Thank you, sir. Any other question?
Yes, please, ma.
Okay.
Hello, good
Why?
evening, ma.
Good evening.
I'm Bilkis. Baba. Thank you very much, ma, for your so much information. I have 2 questions to ask. Hello, ma.
Go ahead, ma. Go ahead.
Okay. I'm asking whether what advice can you give to patients suffering from either depression or bipolar depression, that is psychiatric patient? Because what I realize is one of their medication, especially the Seroquel, it has a side effect of someone feeling hungry easily. So sometimes when they are depressed, so maybe they will be in one place, they cannot be active. So you find out that maybe they are losing weight, rapid loss of weight. So I don't know, Ma, whether there is any advice of the kind of fruits or the kind of food they can be consuming. And my second question is that if someone wants to lose weight, Ma, what among the classes of food is he going to reduce or eliminate from his food? Some said carbohydrate, some said protein. So I don't know. That's why I'm asking. Thank you very much, Ma. Thank you for your.
Thank
Okay.
you. All right, ma.
Thank you, Bill. Okay, thank you, Bilkis, for the question. I will start with your second question about weight management or weight loss. You know, the challenge is that most times we have an ideal picture of what we should look like. Let me just come in from that perspective. Certain people are actually predisposed to, either by reason of gene or they are predisposed to weight gain or being obese. But what actually determines whether you eventually become overweight is actually your lifestyle, what you eat, and then how active you are as well. So diet therapy is actually a holistic approach. It's not just about one particular food. Basically, yes, you will avoid saturated foods like saturated fats. And a simple example is any oil you keep at room temperature and then it solidifies is actually saturated to an extent. So you have to avoid saturated foods. And then basically you also don't eat late. So like I said, diet therapy is actually an individual thing. I'm just telling you the basic thing, but it's an individual thing. Somebody has to assess you, especially let me just say dietitian needs to assess you, assess your dietary intake, your dietary pattern, what foods do you have at your disposal, and then come up with actually an individualized dietary plan that can help in weight management or in weight loss. So that is just basic thing about weight management. And then your first question that you talked about a patient who is depressed and then whose medication actually enhances or increases the patient's appetite. For those patients too as well, you also have to look at what the patient is eating. Because if the patient is prone to being depressed and then probably not very physically active, and then he takes a lot of saturated foods or foods that are highly nutrient dense, over time is going to tell on his weight. So, like I said, it's an individual management. A dietitian can review the patient, see what his daily requirements should look like, and then what his physical activity looks like, and then come up with how many kilocalories the patient should take, and then can also draw a diet plan that is actually fit for that particular patient. So basically, that's just it. I hope my answer actually helps. Thank you for your question.
Much, ma. I don't know, ma, whether I can have how can I reach you, ma, for further request? Thank you very much.
Okay, we can talk after the webinar.
Okay.
I don't know, where are you based?
I'm based in Zaria.
Okay, I'm in Zaria too.
Wow. That's good, ma. Okay.
I work in the teaching hospital, Zaria.
Ma, I'm
Deborah,
also in the teaching hospital.
Can you just put your contact on the chat box?
Okay. Thank you very much.
I will.
Okay, thank you, ma.
And then it would be nice if Mrs. Biliki's Baba can join SSPL. We will enjoy more of Dr. Odudu.
Yeah. So, Bilkis, please try to join the SSPN. And this is not the only webinar that we do. So we also have, every month we'll have webinar. Every other person in the mode of Bilkis, please, if you have not taken up the membership of the SSPN, kindly do that. It's membership fee of 10,000, annual due of 10,000 naira, and then you enjoy so many of our offerings. All right, over to you, Mrs. Akikoli.
Oh, thank you, sir. The last question, I don't know if our presenter will be able to answer it. Somebody wrote that she's having, or he or she is having severe pain in a third metacarpal phalangeal joint. But the thing is, she did not hit the leg on anything, but she's having pain for the past 2 weeks now. She's now asking what she'll do. That she's scared of taking any painkiller. So over to you, ma.
Okay, thank you very much for the question. The first thing is actually to assess what exactly is going on with the knee. It's when we assess, then we'll now know what to do. So don't be afraid of painkillers. Let's get to know, get a proper assessment of what exactly is happening. Then we'll know what to do. You may not necessarily take certain medications. It could just be physiotherapy, or we actually recommend some food. And if you're on the heavy side, we'll also look at how we can manage your weight and all that. So you need to be assessed first before we know what line of action to take. Thank you very much.
I want to appreciate our presenter. Thank you so much, ma. Mr. President.
Thank you very much. I appreciate, and thank you, Mr. President, and the entire SSPN team. Thank you for this opportunity to make the presentation. Thank you very much. Thank you, everyone, for making our time to listen. Thank you.
Thank you, dietitian Ududu. And maybe before you go, Professor Akinpelu is here. She might want to say one or two things before we round up. Professor Akinpelu. Okay. All right.
Good evening, everybody. And I want to appreciate everyone who is here online tonight. I want to appreciate our presenter, and it is a good webinar, and I hope that Dr. Dodo will do us one thing, to encourage her colleagues, many more of our colleagues, to join the SSPN. Please, we need more nutritionists here so that we can have more webinars and participation by them. Thank you very much. Thank you, sir.
Thank you, Ma, for this. We are grateful, Ma. Professor Akinpelu is the immediate past president of the society. I've decided to share the membership payment stuff. So please, if you want to be a member, the treasurer is also here. I don't know if you want to say one or two things. Dr. Oguntoye, people are asking for membership. So if you want to say anything about membership, I hope she's still, yes. Dr. Oguntoye.
I think he has posted it on the group chat.
Okay. All right. So please, we want to thank you. Next month, October, is another time, and the one in October promises to be very interesting. Please look out. In order for you not to miss out on that webinar, kindly become a member so that you'll be able to see wherever we share this information to. But I promise you that it will be as interesting and engaging, even more engaging, because it's going to be a panel kind of a discussion. So I welcome and I invite as many of you and your friends to attend the October webinar. So I want to thank Mrs. Akikole and our presenter once again for finding the time to anchor and to make this presentation. Thank you so very much, and God bless every one of us. Good night.
Thank you,
Good
sir.
night,
Good
Mr.
night.
President.
Good
Good
night,
night, sir.
sir.
Thank
Good
you,
night,
and good
everybody.
night, sir, and everybody, sir.
Good night, oh.
Thank you. Good
Right.
night.
Mrs. Akukule, well
Thank
done.
you. Good night.